Hi, everybody. So happy that this is our first sim of the fall term of 2021. As you know, our simulation today is going to be on Kristen Browne. Up until now, you've had a chance to look at her chart, look at her orders, see what medications are ordered, all of that kind of stuff. And so you're expected to come in having reviewed all of that stuff. What's going to happen next is that you're going to be divided into three groups of students, and two students from each group will come to sim because we have Kristen Browne in three rooms. And so it's the exact same sim. So you'll come in, the pair of you will come in and you will get room orientation, and then you'll start the sim. And maybe you're with Miss McGill and maybe Miss Hajari or maybe Miss Claremont or maybe me, one of the many of us that teach in this semester. Miss Simmons, Dr. Reyes, any of the one of us. And you'll do your sim. And we'll talk about being successful in the sim in just 1 minute. So you'll do your sim, things will progress. Then after the sim, we'll have a little chat in the room about how things went. And then you and your partner, along with the other two groups that went, will have a bigger debrief time. Then you'll come back to the classroom to complete whatever work it is that needs to be completed. So what in the sim itself? To be successful in the sim, you need to communicate to the patient and you need to talk to each other. So communicate with the patient. Sometimes you go in there, you're washing your hands and you're asking the patient something and the person behind the glass can't hear your question. Nobody is dying in sim this semester. Nobody is dying. So if you ask a question and expect a response but don't hear a response, it's likely either the person didn't hear you or we're having problems with the microphone. So just simply say, "Can you remind me what your name is?" or repeat the question. And we're not trying to trick you. It is sometimes there's just a problem with the sound equipment. So make sure you do that. Listen to the patient. The patient is going to tell you what they need. They are not going to say, "It is 10 a.m. and I need my pain medicine." But they are going to say things like, oh, I heard. Oh, ooh, you touched me and that hurt. So they are going to give you all the hints that you need to act accordingly. And you know what? That's true with real patients too. If you actually pay attention to what they need, to what they're telling you, you can figure out what they need. So after you're done with the sim, you will go in and you will debrief, and then everybody will come back over here, your whole group. Everybody came at the same time. Everybody will leave at the same time. You will have a little project that you're working on while you're waiting for your turn or after your turn. I'm going to give you a report in just a few minutes, go through the chart and give you the report. And this is just the one time. So for your whole class, this is the one time that you're getting reports. So you need to pay attention to that. And good luck, and we'll see you in sim. Hi, this is a report on Kristen Browne. Kristen Browne is a 43-year-old female of Dr. Shaw. Dr. Shaw. Kristen came in with acute abdominal pain. We're going to look at her history and physical. All right, she came in with acute abdominal pain in her right upper quadrant, and she was vomiting quite profusely. It started today a few hours after lunch, so she's just been here a short little while. Right after lunch, she had said she ate a little bit of Alfredo pasta, but she did have 3 glasses of wine. Denies any past medical history. Her father died from a bad liver. She takes a daily vitamin, drinks wine. She's a stay-at-home mom of 2 kids. And abdomen is tender to light palpation and firm. And she has hyperactive bowel sounds, and she's still vomiting. We're going to look at her orders and I'll tell you her vital signs in just a minute. She's NPO. Um, they've done an abdominal ultrasound. We started an IV of 0.9% sodium chloride, and she's on the last little bit of her 1 liter of normal saline, and then it should be changed to 87 milliliters per hour when it alarms. She's to get ceftriaxone 1 gram IV piggyback every 12 hours. She can have hydromorphone 1 milligram IV push every 2 hours, PRN abdominal pain. Ondansetron 4 milligrams IV push every 4 hours, PRN nausea. I sent off her labs, and we need to still put an NG tube in her. That's not done yet. Let's look at her results, and then we'll look at her MAR. So her BMP, let's see if we have that resulted. You can see here, BUN is 15. Her calcium is fine. Most everything seems to be fine. Her glucose is 90. Let's see what else we have in here. Potassium is 4.1, and her sodium was 140. All right, her complete blood count shows her hemoglobin is 12, her hematocrit is 37, and her WBCs are 12,000. Her platelet counts is 300. All right, her amylase, find those results for you, is 350, and her lipase is 400. All right, let's look at her MAR. Her ceftriaxone is due now, and her ondansetron she last had at about 1:30, and it's about 8 o'clock now. And she had Tylenol at 12:55. She hasn't had anything for pain. And I'll just pull up the S bar and show you what her vitals were. You should have these already. Vital signs: temperature is 98.9. Pulse is 90, respiratory rate is about 20, and her blood pressure was 130/80.